Assalamualaikum and hello everyone. We, from group number 2, will present about reality therapy.
I will begin the presentation with reality therapy. Introduction to reality therapy. Reality therapy is a specific type of cognitive behavioral therapy that psychiatrist Dr. William Glasser first introduced in 1965. It aims on enhancing current relationship and circumstances while avoiding consideration of past events. Reality therapy are also closely related to choice theory. While reality therapy focuses on the process we make to guide individuals toward a better life, choice theory gives an explanation on the reasoning behind our function. We are also the one who holds control of what we make. According to reality therapy, we as a human are difficult on controlling how we feel, but we can control how we perceive a view and behave. Reality therapy's core goal is to help patients assess current behavior and see if those behaviors are effective way to achieve needs. Studies have shown that reality counseling is effective in treating addiction and other behavioral problems. A study by Karim Jaromny and Mosalinejad, 2014, reality therapy was successful in the situation of metacognition but had no effect on the decreasing level of stress among drug addicts. Roles of therapists. The most important role of a therapist is to develop a relationship with clients by gaining their trust so that they will commit to the therapeutic process. Next, a therapist should not be judgmental. Listening to a client's problem without judgment towards them will help the process of therapy. Planning and sticking out to them to achieve motivation, whereas taking responsibility for oneself is a vital facet of reality therapy. Furthermore, therapists should guide clients in a direction and support the client so they would not give up easily. Last but not least, as the reality therapy is a therapy that stresses on the current relationship and circumstances, events that occurred in the past are neglected. Moving on to approaches, human beings have 5 basic needs. Survival is the most important basic needs. Other than survival, the next 4 basic needs is love, power, freedom, and fun. Basic needs. Survival. Survival includes the basic of shelter, food, sexual activity, protection, health, and water. Survival also applies to how we are able to make decisions for ourselves as a human being. Love. Love and belongingness is a strong feeling of emotion, whether it is a romantic or platonic. Everyone wants to be loved. It is also a need to feel that we belong somewhere, either toward an individual, group, or community. All of these can be a motivator to achieve anything. Power. Power can be described as an ability to control or influence other people. For the need for power, people often want the other person to agree to his or her opinions or view. Freedom. Ever since people were born, they have the desire to express their thoughts and feelings to be understood by others. Fun. The needs for fun are basically being able to enjoy something, whether by laughing or playing. Fun can also be a way of learning skills.
Application therapeutic technique and procedure. The practice of reality therapy is conceptualized as a counseling cycle consisting of 2 components, that is creating a counseling environment and implementing specific procedures that lead to change, explore the behavior and the outcome of their own evaluation. Without realizing it, in fact, there are too many people who are unhappy even though their life basic needs are almost fully met and struggling to implement change in their life. Reality therapy technique can be useful to help you set your goals, evaluate plans that you currently have to determine whether those plans will direct you to your goals, and make plans to implement the necessary change, then take action steps to achieve your goals. Reality therapy process. The basic aim of this therapy is helping clients learn better way of meeting all their basic needs in establishing relationship with the people they choose to apply their work of quality. The first one is involvement. Engagement to build the relationship with the client is believed to be the most important factor in all types of therapy. Without this relationship, other steps will not be effective. This is also known as developing good relationship with client. The second one is WDEP model. This model provides a framework for organizing therapy sessions and for helps doctors remember the choice theory concept in their work. The third one is evaluate current behavior. The therapist must be emphasized here and now with the client, focusing on current behavior and attitude. The next one is commit to the plan. Participants must make a commit to carry out the plan. And the last one is there is no reason, no punishment, never surrender. If there is no penalty, then there is no reason to accept the reason. Note that the penalty can be ineffective with clients who are planning to fail. Limitation of reality therapy. The main limitation regarding reality therapy is that the client must be described exclusively the individual problem currently being experienced. Do not want to open previous trauma or recurring dreams. Reality therapy can only apply now and step in the best way. Keep in mind the importance of taking responsibility for one's own action, realizing that only person who can control his own self. So, this is the conclusion of reality therapy.
That's all from us. Thank you for watching.
So